Right, this is biological explanations and treatments of OCD. So in particular, this is looking at the treatments. For OCD, we look at two areas. The first is drugs and the second is psychosurgery. And this video is going to look only at drugs and how effective they are at chemotherapy. So the first kind of drug that we can use to treat OCD is an SSRI, which stands for Selective Serotonin Reuptake Inhibitor. And this is some diagrams of what happens. So this is a presynaptic neuron, this is the postsynaptic neuron, and this is a normal person. Now in a normal person, what happens is serotonin, these purple dots, is released into the synapse here, and what happens is it hits the next nerve, it binds to these receptors, and then it goes back and it's reabsorbed up here. Now what happens in people with OCD or depression is that they don't have enough serotonin in the synapse, either because there's not enough coming out or there's too much being reabsorbed. So that means that not enough serotonin can bind to these receptors on the other side of the synapse. So when we use an SSRI, what we do is it blocks, that's this red thing, it blocks the reuptake, it blocks the reabsorption of serotonin, so they can't move back into the presynaptic neuron, which means there's more than in the synapse, which corrects the serotonin levels and more can bind to these receptors. So that's the idea of an SSRI. It stops serotonin being reabsorbed and raises the levels of serotonin in the synapse. So that's the first kind of drug we can use to treat OCD. And the next kind of drug is called a tricyclic. It is quite similar to an SSRI. Again, it blocks serotonin being reabsorbed, and it also blocks noradrenaline. So it means that those two neurotransmitters are left in the synapse. So it's a similar kind of idea. The next thing is that we can use is anti-anxiety drugs. And these, for example, are called benzodiazepines. And what they do is they slow down the nervous system by introducing chlorine movement into the postsynaptic neuron, which has a quietening effect. So let's have a look at a diagram of that. So here we are, you can see without benzodiazepines, this is a normal situation. What we're looking at is these are GABA, and they bind to GABA receptors. Let's have a look. There we go, and that means that the channel can open and the chlorine ion can go through. Right, so let's just do that once more so you can see it. So this is a normal person. The GABA is released into the synapse, it binds to the receptor, which then opens, and the channel opens and chlorine can go through. Right, the situation when you add benzodiazepines, that's these green things here, they can come and they can bind again also to the GABA receptor together with GABA, and that means that the channel then can open several times, which allows more chlorine through, which means that this postsynaptic neuron, it has a quietening effect. So that's how anti-anxiety drugs, that's how benzodiazepines work, is that they actually mean that more chlorine goes into this postsynaptic neuron, which has a quietening effect. Right. So that's the idea. Benzodiazepines bind to GABA receptor sites and allow the channels to open more often to allow more chlorine through. And the last drug that we're going to look at is dcyclers, which is actually an antibiotic. And what happens is, again, it's linked to the use of benzodiazepines. It actually enhances transmission of GABA, so it reduces anxiety. So if we go back to our diagram here, if we go back to a normal person, what in this case is happening is GABA is binding to the receptor and allowing chlorine through. If we enhance transmission of GABA, what happens basically is that you get more of these binding to more receptors more often. So it's like a different way of doing it. When you've got benzodiazepines, you get them binding to the receptors together with GABA, and each receptor lets more through. So it's like a different approach to achieving the same thing. When you've got this dcycloserine, what it's doing is it's achieving the same thing in a different way, because it's each time GABA comes through, it allows one chlorine ion through, but it happens more often. Okay, now moving on to evaluation of this biological therapy of chemotherapy. We do have lots of evidence, and you'll find that evidence in your textbooks, Sumro. However, the big problem is side effects, and you know about this already. Particularly, actually, the tricyclics have really bad side effects, but there is evidence to show it's really helpful in treating OCD. So, as always, it'll be a case of balance. You've got to weigh up the difficulty of coping with the side effects versus the fact that it does really relieve OCD symptoms. One big problem with the research is that the evidence is only tested over a few months. So what we really need to know is this actually effective in the long term? Because obviously that's what we want. Like, great if we can relieve symptoms for a few months, good, but what we actually want is to cure people of OCD, or at least relieve the symptoms enough in the long term that they can live normal lives again. But if we only have evidence, if we've only really tested it over a few months, particularly with something like a biological therapy, they're much more likely to relapse than with a psychological therapy, because it's potentially only treating the symptoms. We need to, it might be better than that, it might be kind of treating the cause as well, but we need to have evidence to know that that's the case. The other thing is that this treatment etiology fallacy, what this is about is that it talks about if the symptoms disappear, that's good, but it doesn't mean you've treated the cause. So what we have found is that there is a higher relapse rate in OCD patients who have a drug treatment compared to a psychological treatment, which does suggest that we're treating the symptoms rather than the cause. I mean, the reason it's called treatment etiology fallacy is that sometimes we say, oh, because we've used a biological treatment, that suggests, and it's worked, that suggests that there's a biological cause. It's not necessarily that straightforward. And the key way that we illustrate that is by saying, like, if you have a headache that's been brought on due to anxiety or stress or something, and you take paracetamol, which is